You have tuned into The Voice of Medicine, the medical podcast filled with remarkable stories, first-hand experience, important research, and valuable life lessons. Open your mind, relax, and enjoy. Hi everybody, I hope you're enjoying your weekend and ready for some wonderful stories from the world of healthcare and medicine once more with me, Michael. My today's guest is Dr. Claudine Mathieu. Claudine is a consultant in internal medicine. She specialized in nephrology. She worked a while back as a director of international affairs for a Geneva University hospital. She got a taste of the intercultural medical connectivity, and that sort of predestined her later on to took on a job in Moscow a few years later, where she works as an advisor in medical affairs as well as supporting management with her Swiss and international know-how. So on top of all that, Claudine is also the first special advisor for the International Hospital Federation in Russia. And I'm very happy that she took her time and is going to discuss today with me the intercultural differences in medicine regarding Russia, and specifically Moscow, where she is right now. She's going to tell us a little bit about how medical world looks like in Russia, how she perceived Moscow from the perspective of a, first sort of tourist, and then later on as somebody who actually lives and works there.
Moscow is new every day. It's new every day. Moscow is incredibly dynamic. Moscow is incredibly changing. And I've been here for only a year, as you know. But some of my international friends are here for a couple of years, and they just tell me it's incredible. It's amazing how this town is changing in terms of the offer for the people, the cultural offer, the economics which are going up, a middle class which is growing, extremely dynamic, extremely busy city.
So I would like to start with, how did you get to Moscow in the first place? You always had this, international flair.
Yeah, so as you know, I trained first as a doctor in Switzerland, mainly in Lausanne, and also abroad, mainly in Paris. I have a long experience in public and private hospitals. I've been working with the university hospitals, mainly in Lausanne and in Geneva. And then I shifted into the private medicine, working for big private groups in Switzerland. And then again back to the university hospital, where I was in charge of national international relations, medical affairs of a university hospital. And after some time, I went back into private hospital, private clinic, where I was a medical director of a private clinic in Switzerland. And so with this background, having worked quite a bit in international relations for the hospital, for a public hospital, and then with a private hospital, which had a lot of international clients, I've really been much into this international environment. And we had a lot of Chinese clients, we had a lot of Russian clients, we had a lot of clients from the Middle East, etc., etc. And I've always had a personal interest into Russia, I have to say. Many years ago, I took Russian classes, etc. I traveled in Russia, etc. So it didn't come just from one day to another. So there has always been an interest in this very, very, very specific culture and history. And and I got this offer from this international group in headquartered in Moscow, telling me, yes, we would like to continuously improve the offer that we have for our Moscow and international clients in Moscow. Would you agree to collaborate? So I visited Moscow. I visited the premises of this private group. And I was rather surprised in a very good way. Really great equipment, great technology, very good skilled staff, very good skilled doctors. Most of them also with some experience in an international context. So really a very good level actually. I didn't expect it, but really good level.
So when you came to Moscow, you thought, "Wow, this is better than I expected." Was that the thought that you had when you visited the? Yeah.
I have to admit that was actually the thought. Yes, yes.
But I'm pretty sure that you wouldn't be the only one who would think this way. When I visited Moscow, it wasn't medically related, but I had a similar thought about some things as well. And then my question right now would be to you: why did we have that preconceived idea that, I don't know, it's going to be worse than it actually is, that they're very ahead in certain things?
This is a tricky question.
It's like a Western cultural bias, right? We think West is the best, but
I think we have for many years and during Soviet Union, etc. I think in the West we only got an information which was not necessarily complete. And ever since the breakdown of the Soviet Union, still, I mean, the relationships are complicated, and the information that we get in the West is biased. People who come, they all tell me it's much nicer, much more interesting than they actually thought. But this is there's an information bias, and the bias also the way we try to look at this culture and history. We measure it with our standards, and I'm not sure that this is exactly the right way of trying to understand this culture and history.
What was the reason behind that they brought you in on board? So what were the things where they saw the potential or the need for you to help them out with your know-how and with your experience? You mentioned that they were already very good in some things, but there is still room for improvement. So where are you exactly helping them, and with what exactly?
Right. There are actually several streams, several main tasks. It is about quality and safety. When you say quality in healthcare, you have many different accreditations, many different ways of measuring, etc., many different systems. So they wanted to be sure that they are into an international standard. And this is one of the big topics. They did good quality, but again, even in Switzerland and in the countries around, each country has its national initiative for quality, etc. So it can mean different things, quality in healthcare. So this is one main topic. And the second main topic is strategic development. What do we need in the future? We have what we need today, but where is health development, health providing development going? And this has also a lot to do with the culture of innovation, with digital transformation. So this is a second important stream. The third stream is everything that is about the approach of patient experience, patient-centered, patient first. As we've known it also for a couple of years ago, we have an approach which is often centered on the more on the staff than really on the patient. So putting forward and in the center really the patient experience and the patient's holistic approach for the patient. This is something that we're working on as well. So these are, I would say, three main streams. And then also the big topic of performance management, how to organize processes in a lean way in order to be really effective and efficient. These are universal concerns actually in healthcare. It's not only in Russia, of course, but these are the streams where they wanted support. So quality safety, strategic development, patient experience, holistic approach, and process effectiveness and efficiency.
Did you have any trouble in the beginning? You said you're there for a year now, but did you feel in the beginning that, you're technically there for, let's call it change management. Was there any maybe resistance from certain parties? I mean, you're a foreigner. Suddenly you come, you watch certain things not working out so well, or maybe you see deficiencies, and then you propose another way, or you call in a meeting, explain to people. How was the experience with the change management there?
I would like to say that to strengthen the change management is always a difficult task. Not here. It is. You do the same in a Swiss clinic. It will not be easy neither. You always have resistances. Change management is about transformation in a system. It is important that the people understand where do we want to go. You need a clear vision. They need to understand what will be the benefit for the patients, what is the benefit for them, what are we trying to do. That means they really have to understand the why, and you have to involve them. They really have to be. You need them on board. You really need them on board. Give sense to the actions that you propose. And show them the outcomes. Why is this a better way of doing? And if you implicate them, it takes time, like everywhere. If you implicate the people and you work with them and you show them the why and the how it can work, but it takes time. But this is everywhere the same. Then specifically here in Moscow, what I observed that people are quite they're curious. They're rather open-minded. They're listening, they're observing. They might not do it right away. You will really have to be quite directive. You have to tell them what to do. And at some point they will do it, but you always have to follow up. What was very different in the management style for me here compared to a Swiss context is in Switzerland you have really a participative management style, collaboration management style. Whereas here, you really need to tell people what to do. You need to be directive, otherwise it will not work. There's still some top-down here, which probably will not work anymore in a Western country. Mm-hmm. If you let the people too much freedom and you tell them, come up yourself with propositions, etc. At the beginning, they're really surprised. Oh, you're asking my opinion. Oh, I'm supposed to choose something to bring. They're surprised. It's not so much in their mindset.
So it's something new for them to have this autonomy to work with.
Yes, and that we're listening to them and that we ask their input, etc. That's rather new.
So this is on the part of I would say you call it participative management, or working together, for example, on a project or in change management. Are there other differences that you have spotted, comparing, for example, now the medical side, so how medicine is done by the Russian colleagues compared to, for example, to Switzerland? We can, for example, pick the patient communication. Do you have any experience in there?
Patient communication in Western country has also become much more of a partnership between the patient and the doctor. Mm-hmm. The patients come; they have a huge access to information. They come to see you in your office, having a whole list of possible diagnosis, the symptoms, and they're sure. Listen, doctor, I have all the information. I have a Google doctor. I looked it up, and I'm sure I have this and this diagnosis. So they are very much informed. And they want also to participate in the diagnostic approach, and even much more in the approach in the therapeutic plan. Which option would we choose, etc. This is really widely discussed today, at least in Switzerland. I think it's the same in the surrounding countries. Whereas here, our patients are It depends. The younger generation is much informed as well, etc. The older generation, they're much coming in and they're telling the doctors, "Oh, you are the doctor. Please advise what to do." It's more this paternalistic model still in place, where the patient, even if you tell them, "Listen, we have this option and this option," the patient will not choose by himself. He will really ask you advice. This is the role. This is really the role that he gives the doctor. So this is maybe one of the big differences in the communication with the patient. But it's also in transformation, I would say, because the younger people they have access to any information today. I mean, with via internet, I have access to everything. I have nothing blocked at all. So from the doctor's side, we have set up specific training for our doctors in communication with the patient. With some models that we took over actually from the Cleveland Clinic, in order to have this more partnership approach and implication of the patient. So the doctors, they are getting into this model, they are trained for this, and the patients are still a little bit more reluctant to the model. But communication, doctor-patient communication is a big issue.
Now, when we were looking on the side of still the communication between patients and doctors, how was it with language, by the way? How was it with language barriers? When I visited Russia, I realized that not everybody has, I would say, a basic English knowledge. I mean, in other countries in Asia, it's basically the same, but nevertheless, I was very happy that I had rudimentary Russian knowledge to get around, because the language barrier simply was a problem. So how do you experience that? Is there a language problem, or is the younger generation of doctors a little bit more capable in the English language?
Let's put it like this: Moscow is only a small part of Russia.
Of course.
Russia is a huge country. So I'm talking about the Moscow perspective. In Moscow, still, you have a lot of people who don't speak any foreign language. That's true. Then it's interesting. The older generation, you find people who they're quite good and comfortable with German. Some comfortable with French. Mainly these two languages in the older generations, and the younger generations, of course, English. Then of course not the main part, I would say, of the young people speak really a foreign language. And interesting also to say that the very young generation today, 10 years and less, etc. Their parents, they push them into foreign languages, but not the language you would expect.
Are they learning Chinese?
Mainly Chinese.
I thought
but
so.
But this has also, we would have to talk about the bigger context of this, but that's different. So what does it mean for the doctors? We have here mainly Russian doctors. We have a few European doctors, Israeli doctors, US doctors, and mostly they would do the consultations with the translator.
How is that working out? Because I never had anybody on the podcast so far who could give me a little bit more insights on if the patient-doctor relation or the whole setting is much different, or if it basically has almost no effect if you have, let's say, a middleman who is translating. And then the other question which I would have, is it just any kind of translator, or does it need to be somebody who is specifically educated to be a medical translator?
These are really medical translators, and you need medical translators who have a certain experience in this type of relationship and this type of translation. Then is it difficult to do consultations this way? Not really. When you have an experienced translator with you who has the knowledge of the specific terminology, then it's not really a problem.
You already started the topic of the relation between Russia and Asia. So Russia and China, Japan, and so on. I would be interested, are there many patients? So is there a medical tourism from China and from Japan towards Russia? Or do you rather observe that a lot of Russians go to China, Japan perhaps even South Korea, as far as I have heard, to get their treatments?
What I can say is that Russian patients, for some specific treatments, they still like to go to either Germany, to Israel, to Switzerland, to the UK, or to the US, I'd say mainly, like if it's an oncology treatment or some specific operation, etc. So they're still turned towards Europe. Going to China, to Japan, South Korea for treatment, this is not something that is very common, at least so far. It might be in some fields of aesthetics, because there is, especially South Korea, they're really far ahead in their aesthetic offer. But I wouldn't know more about it. Then for Chinese patients, Asian patients coming to Russia, this is something that is just opening up. Russia has now the competencies and the capabilities of offering good medical treatment to foreigners as well. So there is an opening now to the Asian market, but it's really just a start. The main concern here in Moscow, at least, is really to keep Russian private clients, to keep them in Russia, and to offer them the same they would get in any Western foreign country.
Looking a little bit more globally at I would say, Russian healthcare, do you feel like there is maybe a major issue with certain medical conditions which are very prevalent, which might cause trouble? I talked to a professor a couple of weeks ago, and he told me that the problem that Russia has is, for example, the HIV, which is not as commonly known. So we know it, for example, about some African state, but not many people know about it, and that it's actually that the rates are rather high in Russian Federation as well. Is there something else like this going on?
Let's put it maybe in a bigger framework. We have a population of 146 million of people all over Russia. You have a life expectancy which is in a medium range of 66 for men and 77 for women, but with huge differences according to the regions. For example, in Moscow, you have about 10 years more of life expectancy for both men and women than the average, than the country's average. Then you have actually big improvements that have been made in the last years, with really a decrease in everything that is death by circulatory systems, by tuberculosis, by injuries and poisoning as well. And the infant mortality also went down quite drastically. Then you are right. There are some specific problems which they have to address. It is alcohol abuse, which is decreasing as well. Tobacco consumption is still a big issue, which is decreasing as well. And then still the co-infection, tuberculosis and HIV is an important issue. Then the government, the health ministry, they set up plans every 7 years with main focuses, health plans 7 years. And in this health plan, you have of course, the concerns about the non-communicable diseases, which are, of course, cardiovascular diseases, oncology, which is a main focus today. And in the communicable diseases, it is still tuberculosis and HIV. This is right. But this is specifically addressed. It is still a problem, but we see in the last years, if you look into the reports of the World Health Organization, you can see that there is a clear decrease in mortality, in incidence and mortality in tuberculosis. But there is some increase in this co-infection of tuberculosis and HIV. This is right.
You are also the special advisor for Russia for the International Hospital Association, is it called? And I assume that's here the scope of your activity for this well, let's call it a mandate, is probably a little different than the one that you're doing with the private hospital that you're working at, right?
Exactly. The International Hospital Federation is actually a platform that brings together best practices for all public and private hospitals all over. So it's mainly an exchange of information, of experience, and of practices. And the main idea is really to put Russia into this landscape, where it has not been so far. So we, with the group of European medical centers, this is really the very first group who became a member of the International Hospital Federation. This really in the idea to take over, again, to strengthen all international standards and benchmarks.
In terms of medicine and healthcare, how is it going so far? I mean, since you said that for a very long time, Russia was not part of this picture. And basically, I don't know after how many years now, you have been appointed to be the ambassador here. Do you see that this was, I don't know, were you welcomed with this? Were they happy about it? And what were the first steps that you've probably already done in this field?
So Russia has been much welcomed into this federation. I mean, it's totally apolitical. So it's really people who work in this field who exchange their experience once again. So really no worries. Russia is totally welcome. What is a bit difficult is having them really contributing actively, etc. Because for the moment, Russia is more taking in information and learning from others than sharing their own experience. But I'm pretty much sure in a few years they will be able to share their own experience as well. What is interesting is actually that they're much looking here into the international standards and benchmarks. They look much into the USA, much more actually than into Europe, which is quite interesting. Knowing that, I mean, there are advantages and disadvantages of the American system, but Russia is looking much into the US system, which is interesting. It's more in the clinical approach.
And now, as we already established, you've been there now for a while. Would you recommend, now Moscow specifically, as a occupational place for your European colleagues or for Swiss doctors, for example, specifically? Would you tell anybody, guys, if you're interested in XY, come here. It's a buzzing place. Things are happening. Moscow is beautiful.
Yeah, I definitely would. You have to be a little bit easily adaptable. You have to be patient. You have to be very open-minded, flexible. But then it's a good place. The way you practice medicine is not so different from the way we practice it in Switzerland. The integration with the local colleagues, etc., is not complicated. The patients, they appreciate to have also foreign doctors, at least here in Moscow again. And then the city, as we said before, is a very dynamic, changing city.
Would you rather recommend somebody who is, let's say, rather from the younger generation, perhaps, thinking about doing a partially maybe a fellowship in Moscow, or would you say, I think both sides would rather profit if the colleague was a little bit, older, experienced?
They have well-trained medical staff here. In terms of the studies they do, it's similar to what we would do in the Western world. In terms of specialization, it is maybe a little bit weaker. But then many of the experienced doctors, they had some semesters of work abroad. So what they're looking for in Russia, in Moscow, is experienced Western doctors. They're not much looking into younger doctors who would do some part of training here. That's not usual. What they want is really experienced doctors. So there is a transfer of competencies, a share of knowledge and experience. This is what they're looking into. So the patient. This is what the companies, the clinics are looking for. This is what the patients are looking for actually, and this is also what actually the colleagues appreciate, to exchange of okay, what are your best practices in your country, etc. So what they're looking here for is really experienced doctors.
As a close-up for our talk, I was thinking to ask you, we talked about this before, for a interesting, maybe funny anecdote that you maybe have from your life in Moscow. It doesn't need to be medically related, but I'm sure you had your fair share of experiences when you came there as a newcomer.
Yeah, there are several. If I think of the hospital context right now, I always think of the story that one of my U.S. friends told me. She has been our oncologist. She told me when she first came in, she wanted to empower the nurses. And so she bought stethoscopes for all the nurses and explained them. So I will teach you how to do basic examinations for the patients, etc. So you will have more autonomy. This will be more. This will upgrade a little bit your work. It will be more interesting, more diversified, etc. And the nurses were looking at her like, "Oh my God, we're only nurses. How can we do this? And we're not ready for this, and this is not our role." They were so surprised that somebody wants to empower them. They were almost shocked. So finally, they took their stethoscope, they put them around the neck, etc. But finally, they never used them because it was just out of their normal activities. They couldn't understand that somebody wants to empower them.
It's a very interesting story. As you were saying it, I was thinking, well, perhaps they were overwhelmed by the responsibility that they might actually, get with this. Because one thing is to have a new task, which gives you, as you said, a little bit more power, more autonomy, but it also burdens you with responsibility. Because now you have to do a simple examination, and you should get it right. So maybe that was the reason as well.
You're right. The question of responsibility is a very important question here. People are much afraid of taking over responsibilities. And if you ask somebody for doing a task, he might agree to do the task, but he doesn't want to be responsible for the result. That is true. That is something that I've observed several times. Absolutely.
Claudine, thank you very much for taking your time talking to me. It was wonderful to hear how things are going on in Moscow. I'm sure everybody else is going to appreciate as well to have a little insight about Moscow's and Russian healthcare. Thank you again.
It was my pleasure. До свидания.
До свидания. This was The Voice of Medicine. Make sure you tune in next time and take care.